and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to talk about a community health initiative, and my guests are from the Health Department, Megan DeWitt and Irene Ferrainolo. Welcome.
Thank you. Thank you.
All right, I'm going to be stereotypical for a minute here, and when people think of the Health Department, I think a lot of folks think of care for indigent, extremely poor people. They don't think of it as community health. It's really a much broader organization and goals, right?
Right. Yes, it is. Public health, the future of public health is really all about population-based and community-based health initiatives. We're very interested in trying to focus more on changing policy and the environment and the systems that surround people, whether it's transportation or parks and recreation type systems, as well as the health system, to have a more connected and healthy community. That's really the main aim of public health.
People don't always see that. You guys are a little bit under the radar, and that's why it's so great that you're coming in today and talking about those community health goals. When I look back on the city's community plan,
right,
which you helped work on, it's about 5 years old now, there's some really aggressive goals in there that obviously our community wants. Things like reduced emergency room visits, reductions in child obesity has become a big problem, and frankly, some of us adults are a little heavy too.
We're a bit fluffy.
But those things, people I think tend to see them as an individual issue, and they're not. It is broader than that.
Absolutely, absolutely. And when I was talking about the systems, using childhood obesity as an example, it's a concerted and a coordinated effort is required between the schools and, again, transportation, planning, whether there's bike trails, that type of thing, and the health department, and all kinds of other groups that are interested in the health and welfare of children coming together, putting together a plan and addressing all the issues that affect childhood obesity, not just, and adult obesity for that matter, not just let's come up with a new diet plan.
Right, right. So you guys are starting, and this is loosely tied at least to Public Health Week, right, which is recognized in April.
Right, we celebrate that every April with a different theme, and this year the theme is connected and healthy communities. And that's perfectly aligned with what we're embarking on, which is a community health assessment where we gather lots of data, and all that data is available to the public. We're going to set up a site for it. But anytime anybody needs local data that relates to health and health-related and health style and lifestyle and indicators, they can call the health department and ask for Irene. You don't have to come up with Ferrainolo.
I know, it's a little tricky.
And we can connect them to the different databases and sites where they can find national, state, and local level statistics. But even more, I think exciting part of that is a piece of it where we're trying to gather the public's input, and we're using survey, but we're also doing something called a community insight event. And Megan actually is one of the two folks charged with making that happen here in Hampton and in Newport News.
Yep. So the community insight events, they're a great way to elicit insight on community health from the community members, and that's just the most important piece of this, is we want to hear from the members in our community. Nobody knows our community or the health of it better than the members who reside here. So we're reaching out to groups in Hampton, organizations, if you have meetings already scheduled, to contact us so that we can come out and provide a community insight event, which is simply a facilitated group interview in a way, but it's a great way to just engage all the members in there and kind of get an open conversation about the health of our community, what the challenges are, maybe where the opportunities are. So that is something that people can reach out and contact me directly at the health department if they'd like to set that up.
So you would talk to, Kiwanis or neighborhood associations. I mean, I think in neighborhood associations immediately, or even PTAs. You've got concerned parents with kids, and that's just a great group to grab a hold of.
And that's part of the community health assessment. We want opinions from a wide variety. So not just professionals, but non-professionals. But we want to hear from all members of our community because that's what's going to make it rich. And that's where we want the insight coming from.
So Megan, what will those look like? I mean, do you think people will talk about the challenges to staying healthy or their frustrations or with the medical system or where they wish they were?
Yeah, kind of a little bit of all that.
Yeah.
So it's actually a developed questionnaire. So it's 5 questions. We come in, we facilitate it, and we go through those questions. And one of the questions is, what are the health assets in our community? So what does our community feel is positive for the health? And then challenges, barriers, what they see as an emerging health issue. So those are some of the questions that we ask. And the conversation and discussion that comes out of that is just very rich.
Well, let me ask a question. I mean, on a national scale, when you look at assessments and Hampton roads, we don't land very well, do we? I mean, we have a lot of challenges in the region as a whole, and I don't know if you break it out into individual cities.
We do, and one of the buzz phrases right now in public health is place matters. So that individual's health is very much influenced and in some ways partially determined by where they live. So even within our health districts, Newport News, Hampton, York County, James City County, Poquoson, there is a wide range of health status amongst the population. There's something that the state has now that we can connect people to, and it's called Health Opportunity Index. And you can go to that and find out that the opportunities for health in our locality may be very much lower than the opportunities for health in maybe some locality in Northern Virginia. Or
okay, so what does that mean, Irene? Like, what?
Health Opportunity Index is based on access to healthy foods.
Oh, okay. Which we know in Hampton,
is
a little bit less.
a challenge.
And in the southeastern community in Newport News, having a good grocery store nearby that provides fresh fruits and vegetables is a challenge for some neighborhoods.
Right. Also, the access, transportation is one of those. They look at transportation. A lot of contributing factors that people would not automatically associate with health, but that public health is very
safety is a big issue because people kids can't get outside and play, adults can't get outside and walk if they don't feel safe in their neighborhood.
Yeah, one of the barriers that often gets identified for healthy living is concerns about safety. That almost always comes up when you do a survey or a community insight event, that people are concerned about that. Access to food, of course, cost always comes in.
Absolutely.
So one of those opportunity index factors is the employment rate in your locality and the median income in your locality. And so again, that might give Hampton a lower score than a more again, I always think of Northern Virginia as the comparisons, but again, even within our health district, the Peninsula Health District, you'll find a difference between Newport News and York County and Poquoson. The indexes are very different. It's not to say...
And some of that's the economic average. And a lot of health issues tie to economics and your resources.
And there are good things about Hampton. That, it's not that we're all low scored. We have some very high indicators for health opportunities. Are actually the mix of our demographics is actually considered. It's a very balanced as far as race, and that actually allows people to achieve a higher level of health than if you're part of a very small minority or a fringe group within a population. Our historical and the opportunities and access we have to the water and some of our historical past, that also boosts our score. So we have many assets here in Hampton.
We have a lot of parks. We have a lot of community centers that provide activity and for both kids and adults, recreation, physical activity at very low cost. I think some people have a challenge getting there or finding the time.
Sure.
But we do. I think I appreciate you bringing up some assets.
Yes.
Because definitely there are some.
Well, that's a big part of the, as Megan said, there's 5 questions, and one of them is, what are the assets? What do we have going for us? And I think people are, they generate, like, there's silence always, and then, wait a minute.
People have to stop and think. You know, it's easy to complain and to know what isn't working, and it's sometimes harder to recognize what we do have or what solutions there might be.
Absolutely.
And how to get to those.
Yep.
Definitely.
I'm trying to think. Some of the other assets that have been identified for Hampton as well. So there are our access to water, historical past, our population mix. More than you might, based on what complaints you hear, people are very positive about Hampton City Schools. I mean, that is an asset. I mean, if
it is an asset, and then the city runs those after-school programs that involve both homework and games and physical activity and get the kids up and moving.
Right, and there's been some real concerted effort to increase the amount of activity in that after-school program because the kids have been in school all day and
they need to move.
They do. Who doesn't?
Yeah.
So we're very interested in identifying the assets and the challenges and the concerns that people have. We might, based on the data, identify certain factors like infant mortality and childhood obesity and diabetes is a big challenge.
We have a higher rate of colon cancer than a lot of localities, and asthma. At least we used to. I don't know if that's improved any, but all of Hampton Roads had a higher rate.
Unfortunately, Southeast Newport News has a bigger challenge with asthma, and that may be an environmental issue.
It might be.
But in Hampton, the asthma rates are much lower than they once were.
Good.
And
look, that's progress.
Right, exactly.
Great progress.
Exactly. Let's measure that.
It is important when we think about these plans to look back and see where we've made strides. Because I think it's so easy to just say, oh, this is awful and this is huge. And, we need to put that all in perspective and pat ourselves on the back. So,
absolutely.
On an individual basis, you lose 5 pounds, you're not at goal yet, but you've done something. Or maybe you didn't even lose weight, but you got out and walked. I mean, it's like that on the community scale, too.
Yes.
You've got to credit yourself for what you're doing.
Yeah, you take a look at the King Street corridor now with its multi-use path.
Isn't that beautiful?
It's wonderful. It's wonderful. And the landscaping and the fact that the path is a bit removed from the
you're not walking right on.
Yeah, you're not breathing in the exhaust as you walk your dog or push your baby stroller along. And I see interest in Hampton planning to do a lot more of those kind of things. I mean, that's a very big initiative right now. I
will say, and this dovetails with what you're doing, we have a bike and pedestrian plan that we're developing for the first time, because somewhere in the ballpark of 75 to 80% of our citizens in the last scientific survey that we did said they wanted Hampton to be more friendly to bicyclists and pedestrians. And I think people have that desire, but it's hard to put it into action sometimes. So the more we can smooth their way and provide those resources, it helps.
Yeah, and changes that, I mean, there are changes that require a change in the hard structure, the infrastructure, are very expensive. And so it requires some funds, and Hampton was very successful in getting a grant to start that initiative. I'm thankful to the people in planning that they acknowledge the fact or understand that health is part of that. So we do have people from the health department on that committee, because both agencies recognize that that's how you get people healthier and happier and get a more connected community.
Yeah, and your start with the look at the community health is going to feed right into the next community plan when we go to update that, which I think is around the corner already.
So, yeah. I mean, that is exactly the purpose for doing it, not for us to have a new folder full of data, but to then disseminate that to the community. That'll be our next big step once we get the plan developed, is now take it back out and say, okay, here's what you all helped us develop. Here's our next step, is inviting you to help us implement this. I think that'll bring about more success than we've had.
Perfect timing. Yeah, absolutely. Okay, so Irene, you're in charge of data. Is that fair to say?
I can get my hands on the data as fast as anybody else at the health department right now. So,
Okay,
yeah,
so if
and
people
I'm a
are
bit of a-
looking
yes.
for that,
Yes.
they go to you. And if they're a neighborhood or a PTA or any sort of group
Yes.
that wants to participate in this community health assessment, they should call you, Megan.
Absolutely.
Okay.
Yes.
Yes.
That sounds wonderful. Is there anything else we should say about this before we wrap up?
The only other thing, if your group is not able to accommodate the time, like the half hour or 40 minutes it might take for a community insight event, there is a survey a paper survey that one of us, someone from the health department would be more than happy to bring to the meeting that would take a little bit less time.
Okay. A
it gets-
paper survey. Irene, we're on the internet age now.
I know.
You got to give me that survey, and we will put it online, and we'll be shooting you the results.
I know. Paper. I know. I talked about think about asking the city for their voting little clickies, but
We'll work something out.
I need
We'll
a
talk
young- I
afterward,
need
and
a
we'll
young
figure
person
out how
to
to
do
do this. We've got people who can program.
Okay,
Well,
good.
this is a partnership, and we do all work very closely,
do.
and not just among the city organizations. We need the community out there to
Absolutely.
be involved as well, because it is the community's health. It's not city government's health.
Nope.
It's the community's health.
Exactly.
Well, thank you. Thank you both.
Oh,
for
it's been a
coming.
pleasure, as
Thanks.
always.
And thank you for watching. I hope you will participate in this survey, whether it's from a group or individuals, and help us figure out your health goals, your health challenges, and how we can all work together to make this a healthier community. Thanks for watching.